As a Columbia nurse and one of the nurse practitioners within the ColumbiaDoctors nurse practitioner group, I'm proud to say that very early on, the nurse practitioner group was able to launch a fever and cough clinic. And we were responsible for seeing outpatient COVID-19 related cases for Columbia and NewYork-Presbyterian health system. And over the last 8 weeks, we've seen very high volume, acutely ill COVID-19 cases. And the most memorable moment for me was a young Black woman coming in for what she suspected was COVID-19 related symptoms after her mom had recently tested for COVID-19 and at the time was hospitalized due to COVID. And she sat down and I was getting ready to do her nasal swab and testing when her phone rang. And I watched as she noticed that the number was of the health system and just watched the pure terror and breath and life just leave her body from the unknown on the other side of that phone call. And at that moment, I realized that that nasal swab didn't matter, but what was important to her was the condition and state of her mom. And I put my hand on the back of her back in full mask and gown and gloves. She could barely see the whites of my eyes, but it was important to me that I let her know that I was standing with her and that I was here with her in that moment. And as a provider, there's no way that that doesn't impact you. And as the evidence began to come out and reflect that people of color were disproportionately affected by coronavirus, and we continue to be disproportionately affected by COVID-19. And as a provider and a person of color, there's no way that that doesn't change you. I'm a different person than I was 8 weeks ago. I'm a different provider than I was 8 weeks ago. And I'm proud to be a Columbia nurse and nurse practitioner standing on the front lines within the epicenter of COVID-19.